Patients should come and see us for hand and wrist injuries when swelling and inflammation hasn't resolved within a reasonable amount of time, which for some injuries could be a few days, but other injuries could be 1 to 2 weeks. There are obvious injuries that need to be seen very quickly, but for more subtle injuries, if someone has a laceration and they're unable to move their finger, then we should see that also. Some of the most common hand and wrist injuries that we see here in northern Colorado are fractures of the hand and wrist or broken bones within the hand and wrist, ligament injuries, or tendon and nerve lacerations or injuries. So for injuries that are not immediately surgical, we usually begin with splinting or bracing, anti-inflammatory medications, ice, and elevation to try to reduce pain and swelling. Often patients are sent to the occupational therapist first to improve their pain and swelling and improve their function. And then if none of that provides good relief and return to activities, then we would consider further surgical management for those injuries. So with some patients, we have to show them their x-rays or their MRI, and I usually go through those images with the patient, and sometimes that can allow us to explain and educate the patient on what their injuries are. The other thing I use often is I have some models within our clinic, and I can use this to show the injury that they have or the specific bone or ligament that is injured, and then we can discuss the different options of treatment for that injury. And so I tend to use a large amount of visual aids to help with our education. We have very easy access to ultrasound and MRI within Banner here in northern Colorado. We have an ultrasound within our clinic if necessary to help with some soft tissue injury for diagnosis. We definitely have a comprehensive ability to evaluate and treat patients with all the different modalities that we have available.